what are you going to feel post-operatively? You'll feel a little bit uncomfortable for a few days. You've got some extra weight in your chest, so when you lie down it feels like there might be a brick on your chest. So every time you breathe and move it feels a little bit heavy and a bit uncomfortable. You get used to that, okay? The silicone weighs a little bit more than water, so it's probably an extra sort of half a kilo to a kilo sitting on your chest depending on what size implants you put. You'll get some medication obviously for the pain, and often it's just simple, sort of Panadol, Panadine, or an anti-inflammatory like Nurofen. And that's usually enough to sort out some of the muscular pain. You sometimes may need something a little bit stronger, particularly if you go home that first day. You'll have some local anaesthetic which wears off, but you might need to have some more pain relief that's a bit stronger. As you gradually increase, over the next sort of 1 to 2 weeks, you'll increase your activity a little bit. You might do some walks. The only thing is I don't want you to go to the gym and lift up some weights or go for a heavy run or something like that. It's probably going to be a bit uncomfortable. The breast implants aren't well set in, things move around, you probably need to take things a bit easier. So some gentle walks, go out, have some coffees and lattes with your girlfriends and stuff, that sort of thing is fine. But don't do anything too aggressive to start with. Driving, a couple of weeks down the track, just being wary of the seatbelt. It can put a bit of pressure and make things feel a bit uncomfortable, and certainly you don't want to be knocking the breasts on the steering wheel if there's an accident or anything like that, not that early in the piece. No heavy lifting or exercise for 6 weeks, I usually say. And try to get as much resting as possible afterwards. It sort of helps with the healing. I often say go to work if you've got a simple desk job. If you've not got too much of a laborious job, it's usually okay. 6 weeks, some sort of bra without an underwire, or even just a crop top that's going to give your breasts a bit of support, so nice and firm. Wear it at night if you can as well, just to keep the breast implants in the right position. Sometimes if they're sitting up a bit too high, we put a strap across the top to just lower them a little bit as well for those first few weeks. And then after that, go and get a bra that suits and fits you well. Okay. Post-op care, normally I will try and see you that day if you're going home, otherwise the next day from the hospital. And then you'll have appointments scheduled for 1 week, for 2 weeks, about 6 weeks, 3 to 6 months, and then about 12 months or annually after that, just depending how you feel. If everything goes smooth, I often let it go after sort of 3 to 6 months. And just leave it to you to come and contact me. You've also got my mobile number, and you can give me a call direct or call the rooms if there's any concerns or any issues down the track. And often I'll accommodate you as best I can. So once, some surgeons will do the surgery and then that's it, don't want to know you. I'm pretty happy to keep following up as long as you need to.